Well, you've probably heard a lot lately about trends during this pandemic. Cases trending one way, but testing trending another.
Yeah, and what does all of this mean to you? Tonight, Channel 2 investigator Robert Arnold breaks down the data to show you how it can impact your routines as Texas enters a new phase of reopening.
What is normal? I'm not certain. I don't think anybody's certain at this point.
I'm cautious, but I'm gonna still live my life.
Hopefully it's going away soon.
A lot of us are still trying to find our footing in a new world of pandemics, masks, and social distancing. Some are ready.
We got all of our safety protocols in place.
Others remain hesitant.
Major concerns. I'm going to stay away from people.
Over the past 2 months, we've seen a lot of charts and graphs and heard a lot of numbers tossed around. But as the state begins to reopen, where exactly do we stand in the spread of this virus?
We have a long way to go.
That's the short answer from Dr. Stephen Spann, founding dean of the University of Houston's Medical School.
If I'm looking at these numbers, what should I take away from all of this?
Well, I would take away that this is still a big problem.
The numbers we're talking about are the number of new COVID-19 cases reported each day throughout the state and compiled by the Department of State Health Services. Look at Texas as a whole. We appeared to peak around the middle of April and settled into somewhat of a plateau.
We have not bent the curve downward.
When we checked trends in Harris and surrounding counties, we saw similar patterns, peaks around the middle of April and then plateaus extending into May. Spann says what we need to see are consistent daily decreases in the number of new COVID-19 cases. Baylor College of Medicine's Dr. Prathit Kulkarni does see a silver lining in these numbers, though.
We can take encouragement in the fact that we didn't necessarily see a New York City type of situation.
Kulkarni says these numbers show aggressive social distancing measures did work. Our fatality rate remains around 2% locally and statewide. Even hospital and ICU admissions for COVID-19 cases in our area have plateaued. No big spikes. Still, Kulkarni agrees.
I definitely would not at this moment act like things are over.
Spann cautions we still don't know the full extent of infection because of a lack of testing.
Our case rate may be twice as high as we think it is.
Texas has still only tested about 1.5% of the population. Some rural counties have done no tests. Others have tested less than 1% of their citizens.
We know that about 25% of people that are infected are asymptomatic.
That high?
That high, 25%.
But even that number is not certain until more testing is done. Kulkarni says the numbers at this time support a gradual reopening of the state, but people by no means should let their guard down.
The thing to do is to stay vigilant and keep it up and watch how things progress over the next several weeks to months.
And wash your hands. On click2houston.com, we've got a link to all that state data we just showed you so you can see the breakdowns for yourself. Robert Arnold, KPRC, Channel 2 News.